Charlie is 68 years old. For 11 years. Every morning, he woke up the same way. A pounding headache, shaking hands, and a quiet feeling that something wasn't right. He wasn't skipping his medication. He wasn't eating badly. In fact, he was doing exactly what his doctor told him to do every single morning. At 8 a.m., he took his blood pressure pill. Same time. Every day. For over a decade, it became automatic, like brushing his teeth. And still, by 5 a.m., his body was already under pressure. His wife would find him sitting at the kitchen table before sunrise, pressing his fingers against his temples, waiting for the worst to pass. They assumed it was just part of aging. His doctor adjusted the dose twice in 3 years, but no one ever asked about timing. Then one day, that question came up and everything changed. Charlie moved his medication from 8 inches the morning to 9 at night. Same drug, same dose, same diet, same lifestyle. Nothing else changed. 2 weeks later, the headaches disappeared, the trembling faded, and his early morning readings dropped by more than 20 points. One simple change. Not what he took, but when he took it. Now, before you do anything, before you even think about changing the time you take your medication, you need to hear this part. Because for some people, making that change can actually be dangerous. There is a specific group where taking blood pressure medication at night can create new problems, not solve them. And if you skip ahead, you will miss exactly the information. That applies to you. So stay with me, because understanding the timing is not just about convenience. It's about protection. And if you get it right, you can improve your numbers without changing your medication at all. Let me show you what's actually happening inside your body every single morning between 4 a.m. and 10 a.m. Your system goes through a massive shift. Cortisol rises. Your stress response activates. Blood vessels tighten. Your blood becomes slightly thicker. Clotting activity increases. And your blood pressure doesn't just rise, it surges. For many people, that surge can reach 20 to 30 points within just a couple of hours. Now think about that. If your baseline is already high, that surge becomes dangerous very quickly. This is what cardiologists call the morning storm, and it's not subtle. Research shows your risk of heart attack or stroke is up to 3 times higher in the morning hours than at any other time of the day. So the real question is, where is your medication? When that storm hits, now let's connect the dots. If you take your medication at 8 inches the morning, what happens the next day? At 5 a.m., that's almost 21 hours later. And for most blood pressure medications, that's when the drug level in your system is at its lowest point. Not in the afternoon, not in the evening, but right before you wake up, exactly when the morning storm hits. So think about this. The most dangerous window is the exact moment when your protection is weakest. During the day, you feel fine. Your readings look normal. Your doctor reviews the numbers, and everything seems under control. But no one is looking at what's happening at 5 a.m. when pressure spikes and medication is fading. That gap between risk and protection is the real problem. Now here's something most people have never heard. The reason you were told to take your medication in the morning has almost nothing to do with heart health. It goes back to the 1950s. The first blood pressure drugs were diuretics. They worked by making your body flush out water and salt, which meant one thing: frequent trips to the bathroom. Patients who took them at night couldn't sleep. They woke up again and again. So doctors made a simple change. Take it in the morning. That way, patients could sleep. And the habit stuck. Guidelines were written. Doctors were trained. And the recommendation was passed down for decades. But here's the problem. Modern medications don't work that way anymore. ACE inhibitors, ARBs, calcium channel blockers. They don't cause that same issue, but the timing advice never changed. Not because it's optimal, but because it's familiar. And sometimes, in medicine, familiar becomes default, even when better options exist. So what happens? When people actually change the timing, this was tested in one of the largest studies ever done on blood pressure. Over 19,000 patients, followed for more than 6 years. Same medications, same doses, but one difference. Half took their medication in the morning. The other half took it at night. The results were not small. They were dramatic. The nighttime group had a 56% lower risk of dying from cardiovascular causes, 49% fewer heart attacks, 42% fewer strokes. Same drug, same people, different timing. Now, I want you to pause here for a second, because this is important. If this surprises you, type the number 1 in the comments right now. Just a simple 1. I want to see how many people have never heard this before. Because for most people, timing is never discussed. And yet, it can completely change your level of protection. Now let's go deeper. Because this is the part most people never understand. Your blood pressure is not supposed to stay the same all day and all night. In a healthy system, it drops during sleep by about 10 to 20%. This is called the nocturnal dip, and it's not passive. It's a critical recovery phase. During this time, your heart rate slows, your blood vessels relax, your kidneys reduce workload, and your arteries get a break. After being under pressure all day long, think of it like this. Your body is a highway. All day, traffic is constant. Stress, movement, circulation. But at night, traffic is supposed to slow down, so repairs can happen. But in many people, especially over 60, that dip never happens. Their pressure stays high, all night long, hour after hour, year after year, with no symptoms, no warning. These people are called non-dippers, and the data is clear. Higher risk of stroke, kidney damage, heart thickening, and cognitive decline. Now here's where timing matters. Taking medication at night helps restore that dip. It lowers pressure exactly when your body needs recovery the most, and it prepares you for the morning storm. So when it hits, you're protected. Now let's make this practical, because what you do at night directly affects what happens to your blood pressure the next morning. The first thing is something most people never expect. Your dinner, specifically aged cheese, cheddar, Parmesan, blue cheese. These foods contain a compound called tyramine, and tyramine triggers the release of norepinephrine, your body's main vasoconstriction signal. That means your blood vessels tighten, your pressure goes up, and the effect peaks within 1 to 2 hours, exactly when your body should be winding down. So here's the simple rule. If you eat cheese, have it earlier in the day. Keep your evening meals light. The second factor is how you sleep. If you sleep on your back, you increase the risk of airway blockage. Even mild obstruction triggers a stress response. Your body releases adrenaline. Your pressure spikes over and over again throughout the night. Many people never notice it. They just wake up tired with higher readings. In the morning, sleeping on your side, especially your left side, reduces this effect significantly. A simple change with a measurable impact. Third, your water timing. If you drink a large amount before bed, your body has to process it. During the night, you wake up, your sleep is broken, and that disruption raises cortisol the next morning, which pushes pressure higher. So shift your hydration earlier. Drink most of your water before the evening. And finally, this one is often ignored. Your nervous system before sleep. Your brain does not distinguish well between real danger and what you see on a screen. Stressful news, arguments, emotional content, all of it triggers the same response. Cortisol rises, heart rate increases. Your system stays activated long after the moment passes. So create a boundary. No stress input. 2 to 3 hours before bed. Think of this not as a lifestyle tip, but as a form of treatment, because protecting your night is protecting your blood pressure. The next morning, now we need to pause, because this part matters for many of you. Not all blood pressure medications should be taken at night. And for some, doing that blindly can create new problems. The first group, diuretics. These are medications that increase urine production. They remove excess fluid from your body, and they still work the same way today as they did decades ago. If you take them at night, you will wake up repeatedly. Your sleep gets fragmented, and that alone raises cortisol, increases inflammation, and pushes your pressure higher the next morning. So for diuretics, the ideal window is different. Late afternoon, around 4 to 5 p.m., late enough to still provide protection, but early enough to avoid disrupting your sleep. The second group, beta blockers. These medications slow your heart rate. At night, your heart rate is already lower. And in some people, this combination can push it too low, sometimes into uncomfortable or unsafe ranges. Some people also report more vivid dreams or disturbed sleep. So this is not something to experiment with alone. If you're on a beta blocker, do not change the timing without speaking to your doctor. This is not optional. It's necessary. Let's bring this together. Your blood pressure follows a rhythm, a daily cycle. And the most dangerous moment is not random. It happens every morning, at the same time, again and again. The question is simple. Is your medication working with that rhythm or against it? Because for many people, the issue isn't the drug. It's the timing. And once you understand that, you start asking better questions. Not just, what am I taking? But when am I taking it? And that one shift can change everything. Now, I want to hear from you. What time do you currently take your medication? Morning, night, or somewhere in between? And more importantly, has anyone ever explained to you why that timing was chosen? If this video changed how you think, type the number 1 in the comments right now. Just a simple 1, because for most people, this conversation never happens. And yet, it might be one of the most important questions you ever ask.